Sawchuk, UW veterinarian, is taking your calls at 270-9933, and we will start with Jill in Madison. Hi, Jill.
Hi.
Hi, what's your question?
Well, I have a 7-month-old dog, and I've actually had her for about a month, but she wants to attack you. I mean, she'll be kind of playing with a toy, and next, like, she just kind of bounces on you and just, she'll, like, bite my stomach, my arm. She'll grab my clothes and put holes in them.
Oh, my goodness.
What breed is she?
Yeah.
A lab mix.
A lab mix, yeah. You know, when we see dogs that are aggressive, it really is important that you get to the bottom of this and get a diagnosis, because there are many, many causes for this. It could just be that your dog is overstimulated and you just need to keep, redirect to the appropriate things for them to chew on. But it also could be that she is maybe object possessive, that this is my toy and she doesn't want you to come near it. And so lots of reasons, but those multiple bites, especially if she's causing injury, tearing clothing, causing injury, oh my goodness, I really would recommend that you work with your veterinarian to make sure that your dog doesn't have anything medically wrong with it. Could be hormonal changes, pain, that type of thing, and then also work with an applied animal behaviorist to be able to get to the bottom of what could be causing this, because you've only had the dog a month, and this is just going to get worse before it gets better.
7 months are still, those are adult teeth at this point, right? The baby teeth are gone?
The baby teeth should be gone, but, and so that's where it could just be that this is just a dog that doesn't know how to play appropriately, and by learning how to play appropriately, redirecting to the right things, it may be able to help this dog.
But you got to get to the bottom of it and figure it out.
Now.
Right.
Okay, let's go to Bill in Nishkoro. Hi, Bill. What's your question?
Hi. I have a 6-year-old female golden retriever, and I have the Sergeant's liquid flea and tick repellent on her. And then my veterinarian wants me to bring her in for a Lyme disease vaccination. And from what I understand and read on the Lyme disease vaccination is it doesn't last really long. And a lot of veterinarian schools don't even prefer that you vaccinate your dog with the Lyme disease vaccination. So
yeah,
it's kind of controversial on which way I should go or not go.
Right. The way I look at it is we live in Lyme Central because we live with ticks everywhere. It doesn't matter where you are, city, town, out in the country, makes no difference. Ticks are there. In fact, I ended up with one of the Lone Star ticks, which is a new invasive tick, on myself. I live in Janesville, and just in my backyard ended up picking up a tick. So practice tick control. Use an effective product recommended by your veterinarian every month, 12 months out of the year, because ticks are around every month of the year. Even in January, they come out. And then the other thing that we'd want to do is assess your dog's lifestyle. If they're out in the woods a lot, out in fields a lot, lots of potential tick exposure, no tick control agent is 100% effective, and I do recommend that patients that fit that lifestyle be vaccinated for Lyme disease. There's a really good calculator that you can go on the American Animal Hospital Association's website, and they have a lifestyle risk thing that you can take with you for you and your dog to be able to see what vaccines your dog needs. And you may find out that living in Wisconsin, they're going to recommend Lyme vaccine.
If you're on the country and the dog's out in the field a lot?
Even if you're in the town, if they're out in the field a lot. Yeah.
All right. Let's go to Jill now in Portage. Hi, Jill. What's your question?
Hi. I've got a 3-year-old dog. It's short hair, and it sheds constantly. And just about every day I have to vacuum and empty the vacuum out because that's how much hair.
Oh, my goodness.
That's a lot of...
Yeah. I have 3 short-haired dogs, and my home is pretty much the same. Yeah. And so if your dog is on a good nutrition, balanced diet, has nothing medically wrong with it, isn't hypothyroid, isn't having any patchy hair loss, it's just the normal shedding, the best thing you can do is just keep on top of it with lots of brushing and keeping your vacuum out. It's even short-haired dogs shed, and sometimes those hairs are worse than long hairs because they get woven into fabric a little bit easier and they're harder to pick up.
Absolutely.
All right, let's go to Kay in Verona. Hi, Kay. What's your question?
Yes, I have a 14-year-old cat that suddenly started, she's been pooping and peeing out of the box for a long time, and now she has diarrhea. And today there was blood in the stools. I do have an appointment with the vet. Is there anything I should be thinking about and be aware of?
Well, I would be strongly recommending that you, when you go into your vet clinic, make sure that you have the cat with a full bladder so that they can get a urine sample, and be prepared to have some blood work done as well. A head-to-toe physical exam to make sure that they don't palpate or find anything wrong is going to be indicated too. Also, bring in a stool sample if you can, because even though if your 14-year-old cat's an indoor cat, parasites are low risk, but it's still something that we'd want to evaluate. I mean, 14 years old, it could be anything from something as simple as parasites to badness like cancer and things like that. But I
At
think
least going to the vet, that's good stuff.
I'm very glad that she's taking this kitty to the vet.
All right, Dennis in Lake Delton. Hi, Dennis. What's your question?
Hello. I have a 13-year-old cat. She used to use the litter box, but now she won't use it. I have to put down a dog training pad. Is there any way to get her to use the box again?
Yeah, being 15 years old, I'd really worry about medical problems. Things like kidney disease and hyperthyroidism where they physically can't get to the litter box. Even arthritis can cause cats to have that. A litter box for every cat in the household +1, so you have easy access to it. Keeping it clean is important, but this is another case where medical evaluation is indicated. Just like the last owner, urine and blood needs to be checked.
They want to use the box. I mean,
They do.
Instinctively.
Yes, but they may have some phobia about it because it hurts or they just can't get to it.
All right. We're out of time. Thank you for everyone for calling in. Sandy, thanks for being here.
Thanks, Sandy. Great to see you.
See you soon. And we